Hey, hi guys, hope you're all doing okay. It's Monday and it's a beautiful day here in northern Arizona. The sky is blue, the sun's shining, everything's pretty tickety-boo, as we would say in the UK. Today we're going to focus on level 4 of the 7 levels of dementia. Now level 4 is where we start to see some moderate dementia coming into play. We might use a MOCA to do an evaluation. That's a Montreal Cognitive Assessment tool. It's one that I use a lot, and it's one that the majority of doctors use as a pre-screening tool to determine whether or not there's further investigations that need to be carried out by the neurological team. So people would be presenting with clear-cut deficits on a clinical interview. Some of the things on the MOCA, you can score 30 out of 30, and if you score around about 28, 29 and 30, you're okay. But people would score less than that on the MOCA, and they probably start having issues with not remembering some parts of their personal history. They might not be able to count down from 100 in series of sevens. So there's clear-cut deficits that we're looking for here. Other things like concentration, might not be able to focus, the concentration might change, might be having issues with carrying through with things. The things I always focus on here are things like, what is your immediate memory like? What did you have for breakfast this morning? Where did you go yesterday? What did you do? What family members have you been hanging out with? What about disorientation to time and place? There shouldn't be any at this point. Disorientation to time and space should be pretty much intact. People should know what day it is, what date it is, what year it is, what month, season, their own address, those kind of things. Should be able to do that. Finances, might struggle a bit with finances, so that might come into play there. You might notice that people are not paying bills as they should be, and struggling to work out the financial aspects of their life. Just going to have a look on my little notes here to see if I've missed anything. Yeah, pretty much covers it. So that's level 4. And now when you start seeing level 4, you start experiencing level 4, and you haven't already been to see somebody earlier at level 3, which I suggested you do, then this is definitely the time. Definitely go and get a formal evaluation. The screening tool will give an indication that there is something going on. There's some cognitive decline for some reason. And so a battery of tests need to be carried out. First of all, need to rule out any physical illness or physical disease, such as a thyroid issue, cancer, stroke, heart attack, those kind of things, because they can also impact on that. The medication that you're taking, that might be involved as well. So a full screening is really important, with full labs, check bloods, maybe do an MRI scan or a PET scan and see what that shows. Sometimes there will be a lumbar puncture test done that might have to be carried out. So if you recognize any of those symptoms, or you're challenged by any of those things, please go and get help immediately. Don't hesitate, don't hold back. Because as you know, there are things we can do as soon as we find out that there is some cognitive issue going on. If there's a cognitive decline, through neuroplasticity, through brain health exercises, a change of diet, lifestyle, exercise, removing stress, looking at your medication, all those things can and should be addressed right now at that level, if they haven't already been done so at level 3. Okay, cool. Have a great day, and please share this video with all your friends, all your colleagues. I don't meet anybody today that is not not touched by dementia in some way, shape or form. Okay? Take care, guys, and I will check in with you later. Bye now.